So you probably clicked on this video because you're trying to figure out whether you need a filling or an extraction and what the difference is between the two. So I know this can kind of be challenging, especially if you haven't been to the dentist in a little while. And I think probably one of the most common things that I hear is like, you know, this tooth isn't hurting me. It's not bothering me. I don't want to get a filling on it. I don't want to take it out. But the main thing that you want to think about is the timing of how long this tooth has been this way. Sometimes you can have pain that keeps you up at night and swells up, and you often notice like portions of the tooth starts to break off. Or, you know, you can have a situation where a tooth feels really loose. Now, those are really good telltale signs that the tooth may need to be extracted. Sometimes you may even have teeth that, you know, when you're eating or drinking things, like it just goes crazy. And then sometimes, you know, the tooth could be fine while you're eating and drinking, but the moment that you lay down, you have a whole bunch of pain. Those are things that can kind of really determine like which direction, you know, treatment probably needs to go as far as it being salvageable or being non-salvageable. Now, on the other side, if you have a tooth that hurts and say you drink a little bit of water, but after you swallow everything that's in your mouth, that may be an indication that you could potentially get a filling, but that's not always true. So that's why I always say every time when I do these videos, man, it's important that you get with the dentist that can take x-rays and read those x-rays to you to determine the extent of how bad the cavity really is. Because sometimes it can look one way and you can go ahead and put a filling on that tooth and it's good. And then other times, you know, it can look like bombed out and it just needs to come out. So it just really depends on, you know, how you present. You know, the other thing that I'll kind of share with you guys too, man, I encourage my patients, man, just to look in your mouth, man, and see what's going on. You can go to Walmart or Walgreens or something like that and get a mouth mirror, and you can actually see some of the extent of, you know, how bad they are. You know, you want to look for discoloration or a dark area or a really chalky haze over a particular tooth in certain areas. These are telltale signs that it may be a cavity. I do not encourage you to do what the TikTok people are doing or some of these people that are doing the DIY fixing it type of stuff, man. That stuff is dangerous. And I really don't encourage anybody to do any of that crazy stuff. You got to think about all the training that doctor gets. You know, it's not necessarily by accident. And that's why everybody's not a doctor. A lot of, you know, the things that I'm seeing on TikTok is really cringy for the health community because it's like, man, we're gonna have to fix that. It may be good for a little bit, man, but a lot of times, man, it's like, you're gonna end up seeing us regardless. So why not just be proactive, come hang out with us, allow us to help you, and then from there, you'll be good versus you doing something to yourself or someone else and it just kind of spirals out of control. I do not recommend anybody doing any of this foolishness, man. Just be careful, be safe. This video really went in a whole different direction than what I intended it to do, but I'm gonna go ahead and leave it here anyway. Let me go ahead and just talk to you real quick about a few of these videos. Hold on just a second. Let me get some pictures. All right, so I got my computer, man. I'm gonna go ahead and just look at some of these pictures and I'm gonna probably just throw them up here in the video too for y'all so y'all can see. All right, so this particular picture here, man, this is a really, really heavily decayed set of teeth. You have 3 teeth here. It looks like 3 molars here that are heavily decayed and broken off. It's highly likely that these teeth will need to be extracted, particularly the one in the middle. That looks like that's just non-restorable. Again, we usually use like x-rays. It helps us determine the extent of how bad the decay is. This is just one way of seeing it. So we don't want to necessarily say that this is the end of it. But just based on this picture and my experience of being a doctor, this is definitely one that I would probably elect to have removed. Now the tooth in front of it, that's pretty decayed too. I really would like to see the other side of the tooth just to kind of see how far that goes down on the root there. But again, this is just a one-dimensional view of what's going on. But let's go ahead and keep looking. Let's look at some other photos too. I'm gonna pull up another one. All right. So this one right here, man, this is a relatively small area of decay. And so this one would pretty much be us doing a filling. You can pretty much see that it's pretty small. Sometimes it can get in there and kind of fan out and be a little deep. But I'm confident that we could probably fill this one with just a regular filling. It just really depends on, you know, the symptoms that the patient is sharing. But for the most part, this looks like one that we could just do with a filling. So I got this one right here. This one may or may not be causing some pain, because this is one that's been root canal, but this tooth has actually been fractured too. And you can see that we have quite a bit of dental infection underneath this tooth too as well. So the patient, because this tooth has been root canal, they make sure like it's not bothering or anything like that. They may say sometimes like, you know, I had a little pimple over there, but it usually goes, I'm able to pop it and it goes away. But you do have a fracture here too. But I will go ahead and just take this one out. And that's why I'm always sharing with you guys, like it's really, really important that you kind of get in front of somebody so that they can really help you kind of navigate through, you know, what you need to do. Now, after we take this tooth out, just for, you know, a tip, I would probably, this tooth behind it is relatively, you know, it's restored pretty good. So I'll either look into doing a single implant here for this particular tooth, or I will go ahead and do a 3-unit bridge because of the restorative material between the two neighboring teeth there. Just my preference. Everybody does it different, but that's probably how I would go about approaching it. So, you know, as you see, you know, it's very important, man. It's a whole lot of factors that kind of come into dentistry, how you're looking to, you know, tackle any type of treatment. You know, there may be doctors that's going to get on the chat and be like, man, I'll probably do this, I'll do that, you know, but you know, everybody does it a different way. But you know, obviously for me, it's always my intent to do what's best for the patient, to talk to them about particular goals, to talk to them about what they see their dental health looking like, you know, for the future, because that kind of helps drive care too as well. Because, you know, some patients may not want a bridge. Some patients may not want to implant because they can't afford it, or because, you know, they don't want to do that. Maybe they want a partial. And so those are the different types of things that, you know, you have to really think about when it comes to helping your patients for what they need. And that's why you know, you give 2 or 3 different types of treatment plans so that the patient can know exactly what they need to get. Man, this video got a little long, but that's all right, man. I appreciate you for hanging out with me. Please drop some comments if you have any questions that I can answer. You guys be blessed. I'll talk to you real soon. All right.